his thenar eminence was completely blown up, and the bed was so poor for replantation that I decided to bank his thumb. So it was a epiphany and I'd read about banking. I read a lot about Marco Godina, and he's sort of the father.
That's what came to mind.
So I read about it, and I said, this tool is going to be, I got to keep that in my head. And then it struck, we got to bank this.
Welcome to the DIEP. Today, we're honored to be joined by Dr. James Higgins, a globally recognized leader in hand surgery, microsurgery, and complex extremity reconstruction. Dr. Higgins serves as the chief of the Curtis National Hand Center at MedStar Union Memorial Hospital. He is fellowship trained in hand surgery and board certified in plastic surgery, with expertise spanning trauma, congenital hand surgery, microsurgery, and advanced wrist reconstruction. He is one of only 2 surgeons in the world to have received both the Godina Traveling Fellowship from the American Society for Reconstructive Microsurgery and the Sterling Bonnell Traveling Fellowship from the American Society for Surgery of the Hand. Dr. Higgins has published extensively in peer-reviewed journals, lectured across the globe, and is widely sought after as a visiting professor and educator. His clinical work ranges from everyday hand conditions to some of the most complex cases in replantation and transplantation. Join us as we dive into Dr. Higgins' remarkable career, his leadership in hand and microsurgery, and his unwavering commitment to patient-centered care. Let's dive in.
Really exciting morning. I'm Saïd with the Deep End podcast, joined with Hank, my co-host. We have our celebrity guest, third co-host, and then Dr. Jim Higgins coming up from Baltimore. So thanks so much for coming up, taking the train ride.
Yeah.
We actually have a
couple
hat
gifts
for you.
We got some gear.
And a mug. Yeah.
Love it. Thank you so much.
Yeah.
Apparently there are very few mugs, right?
Yes.
Very few mugs. You got one of them.
We were pretty much reserving them for guests, but then then they became so popular. So we'll see. Maybe we'll make a different one for everybody else.
Yeah. Mm-hmm. But as I was talking to you earlier, I think one of the best things about this podcast is it unites all aspects of plastic surgery. We get to hear from people like you, leaders in hand surgery, microsurgery. We get to hear from cosmetic people, craniofacial people, and we've had a bunch of guests reach out to us wanting to get you up here. So this is like the perfect time. And we find that this allows us to talk about things that you don't get invited to talk about at national conferences, like what inspired you to be a plastic surgeon, hand surgeon, etc. So thanks a lot for being with us. And one of the things we're always curious about is your upbringing, like growing up, things you did kind of outside of medicine, like sports, whatever, and things in your childhood that you think might have shaped who you became later down the road.
Yeah. Well, I grew up on Long Island, so I'm one of 3 boys. My parents are immigrants from Ireland. They left home when they were in their late teen years to find work. And my mom was a nurse. She traveled to England and got her nursing degree and then went to New York. My dad left.
Did you guys grow up close to each other? You're Long Island too.
We were.
We, believe it or not, we probably ran into each other at some point, but we were 2 towns away from each other.
Yeah, it was close by.
Wow.
Yeah. Mm-hmm. I was actually born in Queens, in Bayside. And then family moved to Nassau County, so I grew up in a town called Garden City. 3 boys, and it was a very, Catholic upbringing, 2 Irish parents, and everyone was called by their full name.
But only 3 kids. That's not really Catholic. It's usually like 10.
Yeah, they restrained themselves, I guess. Yeah. So my brother Thomas and John, it was Thomas, James, and John. So the 3 of us were growing up going to Catholic schools, Catholic grammar schools, and then ultimately my mom was enthralled with Jesuit education, and there's a school in Manhattan called Regis High School, which is a all-boys Jesuit, all-scholarship school. So you had to apply, and
it's a very, very prestigious high school. Very famous.
It's a good school. Yeah, it's an incredible place. It's really.
You have to take the train every day.
It's in the heart of New York.
Yeah, it's in Manhattan. It's in the Upper East Side. It's Yeah, you have to take the Long Island
He
Railroad.
had to take the train every day.
Wow.
Yeah.
Back and forth.
Yeah, so it was about an hour, 15-minute commute. At the time, it was the last thing I wanted to do because my older brother had gone to a local Catholic high school, and that's what I wanted to do. And my mom said, you got to apply to this place, and they granted me admission. So I ended up commuting for high school to this school, which is just absolutely unbelievable group of promising young students from all over this sort of tri-state area. Played sports there, primarily soccer. Was a sort of avid soccer player and just always had a soccer ball with me all the time. And this was sort of a passion for me at that time. But I had no idea about medicine. And then ultimately from there, went to Williams College in Massachusetts, where my older brother had gone. And he was a senior, actually, when I matriculated as a freshman. So the two older boys were in Williams College together.
One of your brothers who is the ortho?
Yeah, so he's now an ortho trauma surgeon.
Oh, wow.
He runs the trauma division at University of Utah, and soon to be the president of the OTA. So he's just an incredible person, great success story, great consigliere, great friend, and is a role model for me. So Thomas and I are very tight, and went to college together, where I had no intention of going to medicine. And actually the way it
But he was on that trajectory.
No.
Oh, really?
No. He graduated. He was thinking about politics. He was a political science major. He was doing some time as an intern in a congressman's office, trying to figure out. I admired the fact that he went out and tried to figure stuff out and get some real job experience. There was a team of recruiters that came from Sinai to our campus, and they were looking for well-rounded physicians. So this was at that time and place, there was a need to get people who were humanities majors into medicine. And I was a American history major. And they came on campus and they were seeking out people that were qualified. So I stopped by their desk and said, well, I'm a history major. And they said, well, you can spend a summer at Mount Sinai in Manhattan and do some rotations, sort of like shadowing situations, and then take some classes which you're deficient in, probably like organic chemistry or things like that. And you can get into our program. And we'd really like this because we're trying to make somebody that can communicate with patients better. We think this is the future of medicine. So anyway, I was lucky to get into that program, and then they accepted me. I spent a summer in Manhattan, which I was familiar with, having been there for high school. And then...
So when you went to that desk, when they were recruiting people, were you seeking it out, or were you just like, I'll check it out and hear about it?
No, I think I was on the way to soccer practice. I mean, it just sort of like caught my eye.
Isn't it funny how life works like that?
Totally. Totally. It was absolutely not something that I had on my radar.
Yeah.
Yeah.
Did you have other friends that were going to try to do that program too, or was it?
No.
Really? Yeah.
No. There was a well-positioned desk.
Yeah, exactly.
Yeah.
It really was kind of a bizarre thing. I haven't thought much about it, but so it was a great summer, and you were watching babies being delivered and seeing people do surgery and saying, oh my God, this is amazing. So I then found myself in medicals. I was admitted to medical school, and I was early in my junior year, and I thought, oh my God, I'm pre-med. And I remember that time, one of my friends who was slugging away at pre-med work and MCATs and everything was like, how'd you get into medical school? And I said, well, there's this program. And he said, well, you still have to take your MCATs, right? And I said, well, actually not. And
oh, that's right. So you did one of those programs where you could just bypass it.
Yes. So then I went to my mentor at college and I said, hey, looks like I'm going to med school. And he said, well, that's great. Where are you going? I said, I'm going to go to Mount Sinai. He said, well, you can apply elsewhere? And I said, I don't think I can. So there was a big pipeline between the University of Rochester and Williams College for pre-meds.
Okay.
And he said they really liked University of Rochester, which had a sterling reputation, particularly for the development of a well-rounded physician. Actually, was their mantra.
Right. The biopsychosocial model.
Biopsychosocial model. He said, you should apply to Rochester. I said, well, I don't have a bunch of classes, and now I'm about to become a senior. So he contacted the pre-meds there and said, this is a good applicant. And they said, all right, if you do X, Y, and Z and keep your GPA this high, and you don't need to do the MCATs, but you do this, that, and the other, we'll admit you early admission. By the way, this podcast is going to make me look like some huge corner cutter.
No, not at all.
But
we're not editing that out.
That's how it went down. And then, so then I realized I really loved Rochester.
Why not Sinai?
I had spent 4 years in New York, and I felt it would be good to have a change. I also felt from the mentorship of these people at Williams, they were so in love with the University of Rochester Medical School. It turned out
contagious.
to be incredibly good moment, a chance for me, because so many good things happened to me at Rochester that, so this one person redirected me.
That's the same. It's like the desk. It's like the table or whatever on your way to soccer practice. It's like this one person.
Yeah.
It's crazy.
His name is Hank Art. Yeah, he was a pre-med advisor back then. He's now retired. It's
a good name.
And actually, his son, this is way off point, but his son, Jamie Art, was a freshman when I was a junior advisor. And he was in my Williams College entry. So as a junior, it's like a RA or J. I was a junior advisor. And his son, Jamie, was a freshman, and he was the most mature, just unbelievably emulatable person. And the apple doesn't fall far from the tree. His dad is incredible. Anyway, his dad totally redirected me. Basically signed me to Rochester. So then I went to Rochester, and then I ended up spending a decade there and getting a vocation, a wife, and really good training. So that was a good 10 years. I was at med school there. By now, by the way, my older brother, who had figured out he didn't want to go into politics, then spent time on Wall Street doing a little bit of business work, decided that wasn't it. And then, interestingly, said, hey, what are you doing going to medical school? I said, well, I stopped by this desk.
Yeah, exactly.
And so he started looking into it. He did a post-bac at Bryn Mawr, and then ultimately went to med school. So then the two of us ended up channeling the same direction in the late period. But
so when you were in medical school, what got you interested in plastic surgery? So
this is really a tribute to Joe's work. At that time, he was not chairman, but he was this super dynamic, just force of nature in the department. And so if you were rotating through general surgery, it was clear that there was a lot of, kinetic energy that was getting released in plastic surgery, because microsurgery was exploding. For the town of Rochester, this was the beginning of microsurgery. So you may look at the history of plastic surgery and when did microsurgery start. Well, microsurgery in the University of Rochester started right around that time.
Wow.
So you couldn't help but gravitate to the novelty and the energy. It was a great time to be in medical school and rotating through there. And I thought going into medical school, this is another thing, I thought I was going to be a family medicine doctor.
Tell me about it. It's the first thing he told me when
I was going to say, do you remember the first time you met Dr. Serletti?
I remember meeting.
What was it?
I want to hear.
Well, let him tell.
Okay.
He'll give his version, I'll give mine.
Well, my recollection of it was at Highland.
Highland, yes.
Yeah,
it was
okay.
Highland. Yeah.
So
Highland Hospital was one of the
rotating hospitals. Yeah, it was a small community. Is a small community hospital, but you could go there and get a lot of reps and really cut your teeth. And I was rotating through there, and I was planning on going into family practice. Let's just remember, I was like an American history major, not minutes earlier. And then I rotated through surgery, and it was inspiring. But I recall particularly, I thought it was a craniofacial case, and I think you were just peeling up a face and the whole craniofacial. If you're coming out of medical school and someone's got the face peeled down and you're looking at the craniofacial skeleton,
you either pass out or you love it.
I mean, you're not just going to like breeze through the OR and be like, well, that's going on. I'm going to see if there's something else going on. You know? So that was the big eye opener. And I was scrubbing, and Joe, as per usual, would take a great deal of interest in not just like, here, hold this hook, but where are you in your training? What's your interest level? Where are you going? Can I help? And I think this is special. I mean, really taking the time to figure out if you can help a lot of people. It's tempting to say my bandwidth has been overwhelmed, but you know, here I was, just some sort of like misguided history major that wanted to go into family practice, and he really, you know, why would you even bother wondering? So we explored that, I think, you know, because we was doing a lot of rotating, and then the microvascular free tissue transfer was like mind-blowing. I think the fibula was the first thing I saw, but the thought of just this concept of warehousing the rest of the body and being able to move it about almost penalty-free with some reliability was such a just sort of disruptive idea.
Yeah. You talk about that a lot. Was that how you guys met?
Is that how you recall
My
it?
memory is I was doing a case at Highland. It could have been a free flat breast reconstruction, but I remember you. The craniofacial stuff would have been done at Strong, but you rotated with me for whatever, a month or 6
That's
weeks.
what I
So we
think
spent
is-
a lot of time together.
Totally. And I remember that craniofacial thing, and I thought to myself, there's no way that could have been at Highland, but you know how you sort of, the brush strokes start to blend
I know.
on the canvas?
I think it was a free flat breast reconstruction. And I didn't know who he was. You must have been on a surgery rotation. Did you do surgery at Highland?
I did.
Oh, okay. So
Yeah,
you must.
Joe Johnson,
They must have sent you into my room.
He looked lost, like a young lost.
No. He seemed pretty confident, actually, and a little bit of an attitude. And then I asked him, "What are you going to do?" And he said, "Family medicine." And I said, "Okay," you know, and got through that case. And I'm pretty sure it was either the next day you scrubbed on another case, and then all of a sudden we just hit it off. I mean, I'm trying to think. I'm 10 plus, I'm something like 12, 13 years older than you. I mean, we're not that far.
We don't have to talk age on the
No, I'm
podcast.
just saying that we became unbelievably close friends very, very quickly, to where we did
To the
everything.
time.
You know, when we first met, Bonnie was, she was either a resident or finishing it or an early attending, but I don't think Lacey was around. And we would spend, when Bonnie was on call, we'd spend all night together, you know, watching we loved old movies.
Yeah, that was fun.
It was a lot of fun.
Yeah,
And he obviously wanted to be a plastic surgeon. It was great. It was great energy.
Yeah, and you always say that one of your best skills is spotting talent. And
No question.
So obviously this is a
always
testament
say,
to that.
If I have any talent at all, it's recognizing talent. The three of you are prime examples of it.
Take me out of it.
Yes,
Yeah.
absolutely. So,
It shows you the power of mentorship, though. Like if you walk into the OR and it's somebody who doesn't have the right attitude, not the right atmosphere in the OR, you probably wouldn't have done plastic surgery.
Yeah.
You know?
Yeah, and taking the time to dig deeper. I mean, here we are just saying how great Joe's spot and talent is, but I did hear a little comment about that first impression, which seems to maybe be off. But anyway.
I've told you that before.
I know.
Attitude can be a good thing.
I'm sure it's deserved. But I think the thing about it is, you know, you could have just, there's plenty of rotating medical schools, right? I mean, so just taking the time and digging deeper that takes energy. It's not just falling out of bed, you know?
Yeah, but you're very special, just like the two of you. I mean, I know how to pick special people. I can feel it in my bones. I can't tell you what it's not, I don't go through some analysis. I feel it here. I can look at someone, how they interact with people, their enthusiasm and their passion, and as I said, if I have any talent at all, it's recognizing talent. So.
And that was probably such a crazy cool time. And it
was a very cool time because we were doing all this
exactly
reconstructive first for Rochester first, like every other week. You know, fibulas, ton of radial forearm flaps. You know, front orbital advancement. Everything. It was.
And it's a small It was a small program, so there was just so much chum in the water. I mean, there's so much for everybody to experience that it was really a fertile ground. And that you look back and you say, "Gosh, I'm so grateful that was that time, that place, that volume, that part of the curve." You know. So one microsurgeon in the whole city of Rochester, you know, we're driving around to different hospitals.
One craniofacial surgeon.
Yeah, and you knew.
One in the same.
If you're a resident. Now, I was still a medical student at this point, but ultimately then matriculated to stay home for residency. But at that time, it was, you know, you were aware of every free flap that was going on in the city of Rochester. And so you could just say, that's where I'm going. It was...
and I think there's a photo of you, him, Losi, and Moran, the four of you, right?
Yeah, the Valley Club. Yeah.
Were you guys all kind of within the same period through Rochester?
Oh, yeah.
Yeah.
Yes.
Yeah, so
What an impressive group.
It was a great time, yeah. So at that time, Steve and I were co-residents.
You didn't start that way, though.
Yeah, we each took a year off, a year to do something, and then it sort of ratcheted back and forth, and then we landed.
It was a year ahead of you initially, and then
Yeah.
you took a year off to do a year of clinical research between the 3 years of general surgery and the 2 of plastic, and then you two became co-residents.
Right, because we actually, so we graduated Williams together.
You were the 2000. Oh, right, you were the
Oh, really?
2001
Yeah.
Wow.
Rochester graduates.
So we graduated college together. So we started medical school at Rochester together. And then I took a year off between 2 and 3 of med school. So then he was a year ahead of me, and so then he started, so then I was driving, and he stayed home for plastic surgery, and then I stayed home, and I was a year behind, and he took a year off to do research, and then, so in the end, so it was undergrad, medical school, and residency, and then we finished as chiefs together, but there's only 2 chiefs in that program.
Right. Wanting to do hand. Both
Wanted to hand, yeah, right. And then, so yeah, we were on the interview trail together for hand fellowships.
That's so interesting.
Yeah.
Incredible.
Where did that come from, your interest in hand?
Not from me.
Yeah, I was gonna say.
Yeah, there was that was also super fortunate, right? Because there was periods of that program where there would be not a lot of hand exposure. But at that time, there was a really dynamic hand surgeon named Greg Orlando, who did a plastic surgery residency program.
Yeah.
Was recruited by Joe to be on faculty, and he was really excellent microsurgeon, but also was like a creative thinker and was innovative in upper limb reconstruction, and also was very funny. Like his patients really interacted with him well. He had a good rapport with them. The kind of guy where he made it so much fun that you're like, I think I want to do that, you know. And also there was so much frontier work, it seemed, in hand surgery, meaning there were so many problems that were still needing to be worked out, and that was a period of explosive microsurgery in upper limb work as well. So just being there at that time, and Greg being so invested, and us being only 2 of us as chiefs, it was natural. You sort of couldn't help but gravitate toward it. Also at the time, there is a hand fellowship at the University of Rochester, but it was primarily orthopedically run. And so their fellow was on the sort of orthopedic side, which meant that we had all of the cases for our residents.
Plastic surgery.
And so it made it a bit of a field day again. It was just more volume and more experience. He was also very liberal and permissive for residents to independently operate in a good way with appropriate oversight. And so you really got a chance to test your mettle.
I was going to say, Greg had a very unique gift. He could take an intern through a free flat with the intern doing.
That's nice.
He was an unbelievable surgical teacher, right?
Yeah,
Fair
he was
statement?
great.
Wow.
And he was patient too.
Yes, yeah, you have to be.
But
Yeah.
very funny. And if you didn't do a good job, he would definitely make fun of you. I remember one case in particular, and I don't want to make this run on too long, but there was a case of ulnar artery reconstruction of the wrist, which subsequently became like a clinical and research interest of mine. But so ulnar artery thrombosis of the wrist, and we walked in the room. This is a patient with vaso-occlusive disease with ischemic digits, and we were going to reconstruct the arch. And I'd never seen one before, and Greg said, "What do you think we ought to do here?" I will say, I laid out a very thorough plan, and he said, "Let me see your notes," and I showed him a bunch of notes that I took, and it was one of these classic things, you know, he's like, "All right, put them up on the wall," and the next thing you know, he just like exits. So
Good thing you had notes.
so I dissected this thing out, and then I put in this vein graft, and I was super happy with several distal and one proximal anastomosis. No Greg. Tourniquet down, clamps down, thing inflates, and of course the graft.
Who'd you do it with? Steve? Just
I think I did it with one of the junior residents. And the graft's now like 5 centimeters, 6 centimeters too long. So like the hand sitting on the table, this graft is starting, it's like lying on the blue towel, and then it's going back into the hand. So I'm like, oh my God, and we've all experienced this, right? You put in a vein graft, it's got to be tight. So I thought, oh my gosh. Greg calls in the room. How's it going? Good, we've dropped clamps. All right, you ready to close? Not quite yet. So I decided I was going to take out a middle section of the graft instead of redoing my distals and proximals. Of course. So I did that. Clamps dropped. It's still too long. Took down the second anastomosis. So Greg comes in and he goes, "What is taking so long in here?" I go, "Well, I'm on my third version."
yeah.
But he was very he said, "Good. So you've learned that vein grafts are, can expand considerably after you inside them." And I said, "Yeah, thanks so much for putting up with it." But he said, "I should have told you that before the case started."
You can throw a couple extra CPT codes in there for that.
Yeah, exactly right. But anyway, that was you. In the midst of it, it's super harrowing, but you're so grateful for it when it's over. You look back at that and you remember the case. I remember several cases like that with Joe as well, who was also great at giving us some leash at that time. It was particularly some craniofacial cases. I remember struggling with teeth extractions. Dentist on call wasn't willing to come in.
Oh my.
So we started doing some de novo dentistry that weren't used to. But anyway, it was a great experience. Super sort of dynamic period for us. And Joe was also in this sort of process of ascendancy to chief there. And it was just a great time to be there.
Yeah.
Do you ever, I'm curious as a resident, do you ever stop and think ever at the time and say, at some point I want to be a leader in this field? Or I think I got this. I think one day I can lead a group or be a leader in the field. Did you ever see that coming?
Not really, no. So this may be a theme of this podcast, be not planning anything. But at the time, for me, at the time, I distinctly remember what I wanted to do more than anything was I just wanted to be technically I wanted to be a really good technician.
Yeah.
And that was top of my list. And so I was really in pursuit of reps. I did not see that a leadership role. I just wanted to be the technically best I could, which is I guess maybe that's a weird pursuit, but and I remember when work hours were being diminished, right? And we were slugging away at that time. It was old school, and you'll hear many people say back in the day, but I remember them saying, "Hey, listen, we're going to cut back work hours. So you're going to work about, 60% of all the people that you look up to, all these surgical heroes whose names are on instruments and just worked like crazy, and then changed the world of surgery as we know it. But don't worry about it, you're going to be just as good as they are. And you're like, really? I don't believe you. Who tested that theory out, right? So I was really worried that there would be a work restriction prior to me getting through the race, because I just thought it was such a developmental time. So really, that's what my goal was. I was not looking for a leadership role, and I think that that's maybe a good thing in retrospect, to make sure that you pursue what you think is first and foremost in excellence, and then, if stuff is thrust upon you, that's probably maybe a better way for it to happen.
Yeah.
And some people have said, I guess in the past, and I know you've talked about this at all, and this is why we all look up to you, is like technical ability and your reputation for technique comes first. Last thing you want to do is to pursue all these other things and not have the basis of surgery, which is strong technique.
Yeah.
Yeah,
I mean, when you became chief, that was long after. I mean, you'd established a huge volume of surgery at Rochester, and clearly you were the only person performing microsurgery in the whole city. It was clear everyone was calling Joe. I mean, we already ascended to a position of technical dominance. That's not a great word, but
I like that
clearly
word.
I like that.
Was
Brilliance.
was the leader in the certainly in the city. So that the time was due. It was actually super obvious at the time that a leadership role was coming and should happen. But I think coming right out of residency to say like, I'm looking for your job or whatever, that was the story.
Yeah. I mean, I would say the same. My whole goal coming out of residency was to be, as technically proficient as possible. I mean, I had no vision of leadership or anything. I mean, but I think what Jim did was he established himself as an incredible technical surgeon, and then I think you got to the Curtis Hand Center and Shaw Wilgus and Sandy McClinton. They saw what I saw, this incredible person who is a great surgeon, but also thinks about everybody around him, and treats everybody around him with incredible respect. When you see someone like that, you want to see someone take on a leadership role, and that's exactly what he's done.
Yeah, it seems like
And
every
pretty
step of the
quickly.
way they were fine. It kind of every step of the way it came to you. Like you weren't seeking things out, and you're being humble about it and saying like, "Oh, I just stumbled into it." But there's got to be a reason why every step of the way at undergrad and everything. Like it seems like the opportunities presented themselves because they found you. You know what I mean?
Yeah, there's a little bit of fate there, and I think you could toy around with a pathway, and if you have some success in it, then more successes follow. But there's definitely a lot of stuff, where it's lucky, you're born that time of the year. It's lucky you were at this city at that time. And
So
those
I'm
issues.
sure you're familiar with the book Good to Great, and part of it is interviewing the CEOs of the good companies versus the great companies. And they asked the CEOs of the good companies, what was it that, made you successful? And the answer was typically, well, I did this, and I did that, and then I did this, and then I did that. So then they asked the CEOs of the great companies, how did you become so successful? Well, I was lucky. I was in the right place at the right time. I mean, so
I hired the right people.
I hired the right,
Yeah.
So yes, there is certain luck, but you also have to recognize when you're sitting on an incredible opportunity.
Yeah, exactly.
Yeah.
And again, I think we all share the same philosophy. It's not about any one of us individually. It's about all of us and what we can accomplish collectively.
You're right.
Yeah.
So what took you? Baltimore is near and dear to both of our hearts.
Oh,
I
yeah.
trained there, you trained
Yeah.
there, and what took you to Baltimore after everything?
So coming out of plastic surgery and deciding to pursue hand fellowship, I interviewed around the country, and Curtis, which is our hand center in Baltimore, is a very unique place, and it was clear to me the moment I interviewed there that was going to be, I was ranking it number one. And there's a very organized match in hand surgery, but
How many fellows did they take at the time?
Then they took 3. Now we take 4 civilians, but we also have a separate track for the U.S. military, which is unique to our program.
That's great. Yeah.
So you do work alongside U.S. Army hand surgeons. So at that time, there were 3 civilian slots and a military slot, so there were 4 of us. And it was just a great dynamic institution. With the thing that I remember so distinctly about it was I was impressed with the complete integration of plastic and orthopedic surgery under one roof. There was no, this guy's coming from this department and he's spending some time with you, and this guy will come from this, or maybe you'll rotate through this department. It was really under one roof, and it's really a shining star. And this is, by the way, not my accomplishment, so I'm going to just go ahead and brag about it. But it's a shining star of how that model should operate, and that came through loud and clear when I interviewed. The second thing was, I remember on interview day, I sat down with Sandy McClinton, who is now a professor emeritus and one of my senior partners, and to whom I owe just a huge debt.
Terrific person.
So
Plastic
humble.
surgeon.
Plastic surgeon. Incredible. Great technician, great person. Anyway, he sat down with me between interviews. I remember maybe it was over lunch or something, and he showed me a case and said, "What would you do with this?" And I was on interview, like I had a tie and a suit on. So this, to me, became a test question, right? So I was thinking, all right, what's he thinking? But his manner was so warm and inviting. Anyway, I said, well, in training at Rochester, I think we would approach this the following way and consider this, that, and the other. And he said, oh, that's a good idea. Instead of saying, that's the wrong answer, this is what we did, he actually, it occurred to me, it was like an epiphany.
Yeah.
He was actually soliciting my opinion.
Exactly.
He was not quizzing me.
It shows you the type of person he is.
Yes, and this is the spirit of the place, is that the fellows are completely professionally on level from a sort of opinion standpoint and independent standpoint with the faculty. I know that sounds made up, but it really is. There's volume, there's variety, there's expertise, and there's all that other stuff. But the spirit of the place is that you're coming here as a grown-up. Like, this is, you're starting practice right now, and you're going to be under our wing, and we're going to make sure everything goes right and it's comfortable, but you're going to need to make some big decisions. And I love that. I just loved it. And they're just, to a person, just really approachable people. So I really wanted it. And it is the best hand fellowship in the country.
I always say that. Obviously, I'm very proud of you, but I'll be the first to say it's the best hand fellowship in the country.
Well, I really wanted it, and I was fortunate to get it. And I recall my wife at the time, who I met in Rochester. Megan is a physician assistant and was working in Rochester. I met her on one of our rotations, and that's a whole other story.
That's a whole other story.
I don't
know if we have time for it. Maybe at the end we can tell it. But.
So she and I were now, newlyweds in Baltimore, no kids, and looking for jobs because the fellowship's 1 year. And looking around the country, she was trying to be as non-committal as possible, meaning, Jim, if you think that's the best place for, we'll do it. But
oh, that's great.
Yeah. Then when I came home and they had offered me a job, she was like, that's definitely what we should do. I was like, well, okay.
Oh, that's
she
awesome.
Really weighed in on that one.
Yeah.
Because they asked me very late in the year. It was, I think it was like April. I got called into my office and they said, you'd close the door. I thought I'd done something wrong. I said, listen, what are your plans next year? And it was very late. So I said, well, I've been looking at this job and this. We want you to stay on faculty. And there was no precursor to this. It was almost like, are you talking to me? Like, no one's ever mentioned that. And but I said, well, I'd love it, because they were kind of heroes of mine at this point. And then 24 years passed.
That's crazy. 24 years. Wow.
Yeah.
So what made your wife say, we got to do it?
She was looking at the alternatives and the places. As I said, my brother was in Utah, and we had applied for a job in Utah, and frankly, the job at that point was not a great job for many reasons, but I was making it a good job in my head because I really felt it'd be great to work with my brother, who was an orthopedist. I would actually be in the plastic surgery department that wasn't integrated, and so it was a much different job. And she wasn't too excited to move out west. Her family's in Rochester. She wanted to stay in the East. She had made a lot of good friends in 1 year in Baltimore. She loved the place. So she really lit up when I said that. And I thought,
it's always great when you have the buy-in of your significant other in a decision like this.
I definitely did. And for a job I really would love, I felt super fortunate to get. So it was like easy, done. That's what we're doing.
So when you talk about this, it's the same exact feeling I had when I first started residency here, actually rotating here, and even before here. You see all these giants around you, and it's like, I would love to say, and when the opportunity finally comes to you, it's like, are you kidding me?
Yeah.
Like, why me?
I fully intended to try to recruit you back, 100%. I just had to find the right sort of position and get the right okay, but
it's always nice to.
When you left, I fully expected you would be back.
This is not it.
No, you.
But fast forward a little bit to like. There's first off, fast forwarding to ASRM, where you were like the name at every best case, best save, like Jim Higgins, and then your ASRM Gadina Fellow, prestigious honor. When you
now
think
vice
of
president.
Yep.
About to be president.
Yes. And when you think back to like the best case, best saves, is there a particular case where you're like, this was a really cool case and just like stands in your mind?
Yeah. So that period, and it's funny when people will say,
it's a patient from Israel, right?
We'll
have to elaborate on it later if we have time.
That's another chapter, yeah. Like, Jim, you won all these best hits. That was a long time ago. I will say it's when that contest first started, and I was younger, and I was doing a ton of trauma. And my practice, I hate the word matured, but boy, there's a whole other research and clinical interest of mine that's really usurped a lot of my time. But back then, it was just like I was just doing triple backflip blindies like every weekend. It was because there was a lot of creativity. There was so much support. As 14 partners, you get this huge institution behind you and a ton of trauma coming in because we're a state-designated trauma center. So it was just an open field for a creative but responsible thinking. So I did win a bunch of those. You'll notice my names.
How many? Tell me how many.
I may be wrong, so I don't want to be quoted on that, but I certainly put my hat in the ring for a bunch. And
you won at least two.
I won
at least two.
At least 2 wins, and I think I had a save. And I had. That's a minute.
It's good when you forget those things, because usually most people are like.
I was going to say, can you tell us about a couple of those? Either the save or the best case. Yeah, the one that sticks with you the most, not necessarily the one that won, but.
Yeah, so I just saw. The very first one, I just saw his mom in the office on Friday, and she said, I'm not going to name her name, but she said, you may remember that you took care of my son, Joe.
Did you know that was the mom at the time?
The same last name, and it's a very distinctive name, and I was like, that sounds funny. And she was under the impression that maybe I'd forgotten about him. Now, this kid had blown his thumb off with a stick of dynamite and had a bunch of dysvascular fingers and fractures and all that stuff, and fixed everything. But the thumb and he was young, and it was his thumb. So it was pretty clear we were going all the way, no matter what, to the wall. And his thenar eminence was completely blown up. And the bed was so poor for replantation that I decided to bank his thumb. So it was a epiphany and I'd read about banking, and I read a lot about Marco Cattina, and he was the father.
That's what came to mind. Yeah.
So I read about it, and I said, this tool is going to be, I got to keep that in my head. Like, And then it struck, like, we got to bank this. So we banked it.
Where'd you bank it?
Wells Fargo.
Ipsilateral forearm, so on the radial artery in the same arm, which is a bit of a mistake now in retrospect, but banked it right here, and so the area that we're working on is right here. And why is that a mistake? Because you got to go back and forth to the OR and traumatize this limb, and you've got this very valuable thing hanging on. But I will remember one day in particular, we went into the OR, and there was this nurse, and I'll never forget, she was a great nurse. You know, like these hand surgery nurses at Curtis, like, you can't shock them.
Yeah.
This one's pretty shocking, though, and she had, I will never forget, she had these sparkle things on her, which I thought was so weird in the OR. Like, are you going out to a party later? Like,
or coming out from a party.
Yeah, so they went in, the fellas took down the dressing, they're prepping up the arm, and we hadn't said anything. You know, it was an I&D. And I came back in after washing my hands. She hands me a towel, and she's definitely looking uncertain about what's about to happen here. And it looked as if it was a dew claw. I mean, it was sitting right here. And she said, can I ask you a question about this case? Sure. Is he going to be able to use that? we're planning on moving it back. So anyway, we got a huge team together, lateral arm flap. And
she was probably like, this surgeon really isn't good. He doesn't
His
know
anatomy.
Yeah, he totally missed. But it really unlocked a bunch of ideas for us because, not to get way into that case, but we decided to harvest the entire length of the radial artery in continuity with the end-side anastomosis so that we could then transfer it forward, and it gives you this like mature leash, and then rebuild the radial artery approximately. There was a lot of steps, but anyway, that kid ended up then going into the U.S. Army. It's like, you know, one day he came back to me. He hurt his thumb because he was dunking a basketball.
Oh my God.
I thought, okay, this kid doesn't feel too restrained, you know. His mom was furious. Anyway, I saw her I think on Thursday.
That's so crazy.
She said, you know, your name in our house, you know, it's a special spot.
Very special.
That's special.
Yeah, the award is not worth as much as that interaction.
Of course. Yeah. It was
so special.
Yeah, the encounter with the family and like where you now reside in their trajectory of their life is it's incredible.
And I've said this many times that we underestimate the impact we have on our patients' lives, and we all of us should just take a moment from time to time to take a step back and realize, but we have an incredible job.
No, you're right.
Right, no matter how much people complain about it, right? How many times in the doctor's, this doesn't need to be on tape, but how many times in the doctor's lounge you see people sitting around and they say, oh, my daughter's in high school, but I'm not going to recommend she go into medicine. It's such a different landscape now. It's so difficult. The insurance plans, blah, 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 whatever. And yeah, I mean, it's harder, but in the end of the day, like, is any stockbroker going to come home? If you interviewed a stockbroker, what's the best moment you had? Well, I remember when I doubled this person's earnings from a T-bill back in, you know.
Yeah.
Like, what is the most satisfying thing you're doing? Nothing. Like, and nobody in their family says, boy, you really moved the needle for us. You know?
That's been a theme on our podcast a couple of times, just about how, like, a stockbroker, they can't wait to make their big, like, break and get out as fast as they can or whatever, whereas a lot of surgeons are operating way past when they would need to still be working or whatever, but it's all the other things that make it more special.
That's a very interesting observation, because if you look at CNBC and you look at the people these experts that they interview, they're all young people. They don't interview old people because they're gone. Yeah, I think you're right. Yeah, I think you're absolutely right.
Yeah, I think it's a bit of a drug, really. Everyone wants a win. We all want wins. It's natural, and I think particularly plastic surgery, and particularly I think free tissue transfer. For me, if someone says, "I've had my ankle operated on, 7 times," or this upper limb has been open and I came from St. Elsewhere and wallowing in their hallways, and they sent me to you because you're going to come in and be the closer, like you're the guy that's going to turn this whole thing around. And if you think you can, it feels good to be up on the white horse and like coming in and just like fixing everything. That's a great feeling, right? I mean, if you're privileged enough to be in a situation where you could do that, and we miss, there's plenty of times we try to and we miss, but you've got time and time again an opportunity to be the closer.
Make a difference.
I think that's why I like, plastic surgery is still the most, if not the second most competitive specialty, and I'm hoping that it's because a lot of people see what we're talking about, like how these priceless rewards that are so special. And medicine in general, I think nowadays people think, finance, you make money right away, you make a good bit of money right away. Medicine, you're in debt for a long time, and then you become a surgeon that makes okay money, and I think a lot of this decision making is money driven, but I think it's important for the audience too to know all the priceless rewards that are so special. Like, I don't feel like no offense to my boss, but I don't feel like I'm working. I really don't. Half the time, I really don't feel like I'm working. I'm not even kidding you.
Right. Plus the ethical clarity. Now, granted, we move in ethically cloudy areas from medical ethics standpoint, but the ability to put your head down on a pillow at the end of the day and say, I know every decision I made today and this week was in the best interest of my patient and not some sort of financial, the ability to misstep in the world of finance, I would guess, is so much easier than in medicine, where you do feel like you are literally on the same side as a patient every time. You're always on the patient's side.
Yeah. I'm going to be honest. As an intern, I feel like I'm working.
Well, that's different.
Yeah, I'm just kidding.
It's hard to get that one-on-one direct reward as an intern.
It'll come.
I'm just kidding. Yeah.
And then with all of your distinctions, awards, the Gadina traveling, the ASSH visiting professor, the Zamboni more recently, and Bunnell, what do you think's been the most impactful on your career? They're probably all equally rewarding, but what do you think's been the most impactful?
I think
there is one.
For sure, it's not so much the accolades, and that is nice, but I actually give a talk to our fellows at the end of the year. So before you leave, we need to talk about this. The importance of traveling fellowships, the value of those. It's not a requirement for a successful career, but it is, and you have to approach it the right way, but it is so impactful for so many people that I know that have done them. And they don't need to be a named big one that, you would recognize in hand surgery or microsurgery. Even if it's unnamed, even if you say, I'm doing this de novo, Joe, do you mind if I take 6 months, well, maybe not 6 months, a couple of weeks off and go somewhere where there's a super inspirational person that I want to see?
Absolutely.
I told her to help you out. So there's so many awards there. One is obviously figuring out the challenges of somebody else's practice. The second is exchanging ideas, and you should always look at it as an exchange. You're not there to just sort of lecture, nor are you there to just absorb. You both are going to bring something to the table. But just the breaks, like putting the brakes on long enough for the cocktail napkin on the flight to generate ideas. That time, because especially when you're super young, especially if you're a trauma-heavy practice, you may just be swamped and just churning trauma, and you just need to get that distal radius fracture done, and then move on to the scaphoid, and then and you got to do this flap and next, and you just can't say for a minute, is there a different way to approach this? So for me, the first one that I did was the Gadina, and that was inarguably the most important year of clinical development for me, and the reason was that I took that time out, and the value of the named fellowship isn't so much that you're necessarily going to get more out of it, but generally speaking, the places you go, they're trying to line stuff up for you. Whereas if I called and say, hey, I'm Jim Higgins, you've never heard of me, I'd like to come to South Korea, and I don't have a calling card. They'll be like, all right, yeah. I mean, if you want to come next Tuesday, I think I'm in the OR, and then Thursday, and you're just following someone around, you know?
I think they have heard of you, by the way.
but if you get this calling card, that helps a little bit, you know?
Yeah.
Because like, oh, this society must think he's worth or she's worthwhile. So I'm going to line stuff up. What's your clinical interest? And then next thing you know, the table's getting set. For me, it ended up being a lifelong and career-changing interaction with a surgeon named Heinsberger, who is Austrian. And Heinz and I met at a podium once. We were asked to speak at the same symposium. And as I'm listening to his talk, I'm like, this guy's doing the same thing I'm doing. And yeah, it was just sort of the same thing in reverse. And then we collaborated. I dedicated a fair amount of my Gadina to time with him. And that sort of launched a lot of vascularized cartilage transfer work, which ended up being a big research and clinical interest. And now it's a huge percentage of my practice, which is weird, but it really turned the tide. So it wasn't just a great line on a CV, you know?
Yeah.
It really moved things. And then subsequently, you know, like there's a Benel fellowship. By then we were off and running, and I said, all right, I'm going to spend a good chunk of my Benel time in Austria working on fine-tuning this. So stuff had evolved. I think if by the way, if a listener, if anyone listens to this other than my mom, no, if a listener,
It might just be the four of us.
is that right?
And my mom too.
A listener of this podcast or a trainee, and I think that probably is a big target. One of the things I would say to our fellows, and I think is just super important, is that there's a sense that the Gadina, the Benel, and there's a bunch of named fellowships, that those are the field of the greats, like that I can't apply to that because no one knows my name somewhere, or because I didn't come from a humongous institution that's well recognized, that I need to be 10 years in plus. You just got to throw your hat in the ring. And more often than not, if you do good work and you keep putting your hat in the ring, your day will come, and that will be super, super worth it. And so I think sometimes the bashful early career surgeon will miss out on an opportunity that could have just like uncapped so much for them. So I just say to our fellows, if you ever tell me that you can't apply to a fellowship, that's gonna irritate me.
You can't be fearful of rejection.
Yeah.
And by the way, if you fail, you apply every few years and you don't get in. That's okay.
I'm curious. You were saying you were an avid soccer player. Now, looking how successful you are in all your leadership roles, how much do you think played a role in how successful you are now?
I think it's important team sport, you know, and of course people speak of the importance of team sports. But it is something that I played in a adult league for a while, but obviously put it aside because I started thinking there's a pretty good chance something's going to go sideways here. Probably I would say the other sport that was a huge part of my life and continues to be so is outdoor activities and climbing and hiking, and a ton of time with my family camping growing up. During college and after college, I was leading for an outdoor company as a sort of an outdoor adventure
like a counselor. So brought us to a bunch of different places around the country, and gave you confidence to be able to manage unusual situations and some durability. I think to say that meandered into the operating room with me is a little hard to say, but I do think it's a great maturing, becoming comfortable in the outdoors. I'm trying to instill this in my kids now, but it's a very maturing aspect of life, that portion of it, and I hope I succeed with my kids. But
yeah, I feel the same way. And then talking about Curtis and kind of looking into the future, under your leadership, Curtis underwent a multi-million-dollar renovation, we were talking about it earlier, and its name around the country. We always talk about this when our residents are interested in hand. We're like, Curtis, you got to think about it and talk to Dr. Higgins, et cetera. So it's such a special place, and under your leadership, I mean, it's continuing to be that way. What's next step? Like, do you have a next step? Because now, you talked about at one point, like, my goal was technical ability. You're beyond that. So now that you've done all of this, what do you think your next step in your career is?
Oh, man.
It's okay if you don't have one.
How much time? Oh, I got plenty of them.
What time's reservation?
I'm definitely...
11:45, so
Okay.
I would go another 5 minutes.
Yeah, I would say I'm definitely a person that looks at years, and I do like to project what's going to happen this year, next year, what our goals. So I'd say in the larger picture, our center has expanded physically, and its physical plant is a great thing, and it's expanded our number of surgeons and our capability of managing volume and all sorts of things like that. Still, first and foremost, I want it to be and remain the best training program in the country, and we do a lot year in, year out to continue to improve that. The pieces that I think I'm deficient in I feel like I've hit a lot of the goals that I wanted when I actually wrote up a strategy when I was being considered for the role of chief and now chairman. We're actually a hand surgery department,
Wow.
which I think is unique in this country. So I've hit those goals mostly, and I say that not in a boisterous way. I've had a lot of time to do it, so I think that most people hit those goals. But now I think it's really more of a strategy, a expansion strategy in terms of our service line in the region, and also a continued opportunity for visibility and career development for our younger surgeons. This is something that, and you'd sent me, thank God it's only 5 minutes left, but you'd send me a list of questions, and one of them was like, what regrets do you have? And
Yes.
I think if there was something that I would say, and I'm so satisfied and so lucky and sort of born under a shamrock, but if there's something that I could have done better over the last years, and I have an intent of making right on that, it's probably had more coaching. Like, I think people speak about surgical coaches, and I don't feel like I necessarily need a surgical coach, or if you got an anger management problem, you get a coach to babysit you in the office. But there's so many other aspects of coaching, strategy. It's Joe and I, we should talk more about this, but strategy, economic expansion.
Like professional growth, professional coaching.
Oftentimes in surgery, I feel like we look at our departments and our colleagues, and you say, we need a new leader. I need a new chair, a new chief. And you look around at your horses in your stable, and you say, I'm going to take that one because he's a superstar surgeon or something like that. Like, we take our best clinician and put him at top. And that's actually maybe not what we need. That's an important piece, but you need someone whose skill set is geared towards strategy and towards, to a degree, bridge building, contract management, faculty expansion, all of the other bells and whistles that are an effective leader. And I feel, to a degree, over the last 15 years, that I have been figuring that out on my own.
Yeah.
I don't want to cry unsupported, but it's my own fault for not seeking out people when I need them for decision-making processes that I don't have as much experience with. So that's
That's a good point, and we don't hear that often.
Yeah, no matter how successful you get, you could always use a coach. I mean, Roger Federer was #1 in the world, and they all have coaches, so it's not, everyone needs some.
Oh, you're right.
Totally.
Yeah.
Starting out earlier and getting, if someone said, hey, you're going to be a leader of this program from here on in. Now, by the way, this institution's got such an infrastructure, but any young graduate that's going around the country, particularly if someone says to you, this is a growth opportunity, worrisome, right? So just, can I fill
red
those
flag.
shoes?
Yeah.
It's a growth
Yeah.
opportunity. You got to say to yourself, all right, well, it's not just my job, and is there going to be volume, and what day do I see patients, but what's the cabinet, for lack of a better term, like who's going to help me with these types of decisions and those types of decisions, like who's going to, residency director is one, but you could have a strategy director, you could have a philanthropy director, an alumni relations person. I mean, there's a lot of things to hit on all those cylinders and crush it on each one of them. It's hard to do. So I think that would be my goal, would be some more coaching over the next few years.
Yeah. I have one more question for both of you, and then we'll ask the last fun question. But I'm always interested, like, I think back to, like, my high school friends, you talk about your high school experience, how special that was, my college friends, and people that I've lost touch with over the years, just because we get busier and busier, we have our families, etc. You guys have done such a good job keeping in touch. I know a lot of it comes from you. Your relationship with Joe Losi, your relationship with Dr. Higgins, and how do you guys make it so that you keep those strong relationships that were so impactful at one point, but you don't want them to go away? Because it's hard. Like, there are a lot. I can name 10 people right now that I wish I kept better in touch with.
Totally. I will say that's a special skill of Joe's, and it's undeniable, and anyone that knows him knows that. I mean, that is the extra effort made, just in the same way as extra effort seeking out the talent among a totally unknown medical student, but also the extra effort that is required to maintain and nurture relationships over time. And there's there's a small army of people that can say the same about Joe's always putting the extra effort in, and it pays off, and it's these relationships are super valuable. For me, I think Joe and we have a ton in common. I think that's true. But I'm like, I sort of veered off into this like super specialized corner of plastic surgery, which is pretty far afield from what Joe does. But still, there are aspects of leadership where I've turned to you and said, Joe, what do you think I've got to take care of this issue on my faculty or this trainee? What have you had experience with HR, with this, that, and the other? Where I think I can glean leadership tips that don't necessarily have to do with hand surgery.
Yeah.
And that's something that he's always willing to give. I do think there's something to be said for the proximity, right? Joe, fortunately, moving to Philly.
It's a train ride.
Has certainly helped. But yeah, you're right. I mean, if I think of the national meetings that we go to are completely different. So that's not, because I don't.
Other than ASRM.
Yeah, ASRM.
And that's the other beauty of this podcast too, even at a professional level. You always say it's about bringing all the different aspects of plastic surgery together, because we always go to different meetings and stuff, so you don't always get to, sit down together in the same room and figure out what's alike about everything that we do.
Yeah. It's a great idea, you guys.
So thank you for joining us. This has been such a special. We've had not only you coming in studio, we haven't been in studio for a while, our celebrity guest co-host, and also to get the different aspect of things you want to say about yourself, but that you were able to chime in on, I think was really special too. I just have two last questions that we ask everybody, fun ones. What's your favorite surgical instrument?
The Freer.
And why?
That was my answer.
Yeah, that's so easy. The Freer, just so good on perineural, perivascular planes, and also, is remarkably sharp and remarkably dull when you need it to be, is safe to use by almost any person holding it.
Love that instrument.
And it's actually a fantastic retractor. Like if you're trying to escort someone through a case, you can play defense with the Freer. Very
hilarious.
Slap the instrument.
Very readily. The nurses know.
Yeah.
There's
and
no
then what music do you listen to in the OR? Or what do you like to listen to?
I think a wide variety, but I do have a tendency to listen to bluegrass music in the OR. That's a little bit unusual, and that's born out of some exposure to bluegrass early in college for guitar play, but also, classic rock and Coldplay, U2, that type of thing.
Awesome. Great.
Well, awesome. Thanks so much for joining us. Yeah, this was really great.
Well, kudos to you guys for doing it. It's a great idea, and I think it's going to be something that people will enjoy.
These guys have just done an unbelievable job with this. It's become enormously popular. So congratulations to both.
Yeah, way to go.
Thank you. Thanks for your support.
Yeah.
Of course.
This goes back to you. Yeah. And for your support today, too.
Yeah.
My pleasure.
Thank you for listening to The Deep End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The Deep End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.